Welcome to Mindful Objective, the podcast where we explore health from a grounded, root cause perspective, one that's holistic, practical, and never been on a one size fits all advice. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today's episode is dedicated to your questions, real, thoughtful ones we haven't tackled yet. And in this episode, we're unpacking what those signals might be telling you through an integrative lens and real life solutions brings to the table. As always, this podcast is for educational purposes only. We do not diagnose, treat, or cure any illness or disease. Let's get into it. Listener question number 1, Sarah 32 from Massachusetts. I'm hearing about grounding, also called earthing, and I don't know if I should take it seriously. A friend of mine swears that walking barefoot on grass every day helped her anxiety, and she said it could help with inflammation and sleep too. I'm someone who struggles with both. I'm not against holistic things, but I don't want to waste my time on something that's all hype with no science behind it. Can connecting to the earth really affect the body's nervous system or immune system in any measurable way? Have you seen it help people in real life, or is it just one of those wellness trends that doesn't do much for most people? So, Sarah, it's a good question. You're not alone in thinking how it sounds a bit out there, but grounding does raise eyebrows. But let's look at what we actually know. Grounding refers to direct skin contact with the surface of the earth. This could be grass, soil, sand, or water. The idea is that the earth has a negative charge, and modern life, shoes, buildings, electronics, disrupts our body's ability to stay electrically balanced. So some studies out there have shown grounding can reduce cortisol levels, lower markers of inflammation, improve sleep, and even regulate autonomic nervous system function. For example, there's a 2015 study from the Journal of Inflammation Research found that grounding reduced delayed onset muscle soreness and helped calm inflammatory markers post-exercise. Another would be a 2012 study which showed improved sleep and reduced pain in people with chronic issues like fibromyalgia. So the mechanism is thought to involve free electrons from the earth naturalizing positively charged free radicals in the body. While it's not mainstream yet, the potential is there, and it costs nothing to try, right? If walking barefoot on beach or grass makes you feel calmer, then it's a psychological benefit worth acknowledging. Try consistently this for maybe 10, 20 minutes a day and journal how you feel. Might surprise you. One thing I would just say out there is there's a lot of products out there, earthing products, bed sheets and stuff from China with synthetic materials that could be more toxic than beneficial. So if you're going to buy sheets, see where they're made at and the quality they're made. Listener question number 2. It's James, 49. He lives in Texas. He says, hi, I work as a firefighter and my schedule is all over the place. We do 24-hour shifts on, sometimes go days without real rest. I eat clean, drink water, and try to take care of myself, but my digestion is a mess. I put on belly fat and I feel like a zombie some days, even when I sleep a full 8 hours the next day. I heard you talk about stress and the nervous system before, but how do people like me stay healthy when our lives don't allow consistency? Is it just damage control? Are there routines or specific things that I can do to help my body from breaking down? James, first off, thank you for your service. It's a great career. So shift work is brutal on the body, especially over time. You experience what we call circadian rhythm disruption, and it affects everything from digestion, hormones, cognitive function, immunity. Another one would be even metabolism, right? That consists of weight gain, heartburn, daytime fog. These are all classic signs that your internal clock is out of sync. So here's a few ways to protect your health even when you can't change your schedule. Light management. Expose yourself to bright light, ideally blue light enriched, during your shift, and block it afterwards while blue light glasses are there to help your brain understand it's ready to wind down. So darkness triggers melatonin, even if it's daytime outside, right? Especially if you're sleeping during the day. Got to get it dark. Got to get your body on that right cycle. Another one would be meal timing. So you want to avoid large meals right before or during night shifts. Opt for smaller, easily digestible meals with protein and fat to keep blood sugar stable. Try to eat your largest meal when your body expects it, usually late afternoon if you're on rotating off nights. Another one you want to do is gut support. So consider digestive enzymes or a little apple cider vinegar and water to help ease heartburn and sluggish digestion from odd eating times. I know the shifts are rough. Supplements, magnesium glycinate, taurine, L-theanine, these can help support your nervous system and rest quality. your sleep environment, right? Use blackout curtains, white noise, keeping your phone out of the room. This is critical. So treat your daytime sleep like it's sacred, right? Sleep's very important to the body to heal. Take it seriously. You might not get perfect alignment, right? But consistent rituals and smart strategies can make your body more resilient despite the chaos. Take one day at a time, slowly reduce and get on the right path. Listener question number 3. And this episode here, we only have 5 questions, so it's not going to take up much time, but we didn't have much this week. So listener question number 3, Deanna, 26, California. I'm not overweight, but I feel like I have no muscle tone and get windy easily. I heard the term skinny fat. Could that be me? How do I even start to fix that? Yes, what you're describing does fit common definition of skinny fat, where someone appears slim by weight or BMI, but has high body fat percentage and low muscle mass. This is more common than people realize, especially among women who never resistance trained or who undereat protein and calories, right? So protein's a big one. We always say, eat more, not less. To build muscle and improve energy, you need enough calories, especially from protein. So get at least 0.8 to 1 gram per pound of body weight daily. Again, try that 30 grams of protein within 30 minutes of waking. Another one would be strength training. This is key. So start with a full body workouts 2 to 3 times a week using weights and resistance bands. You want to focus on compound movements, squat, lunges, rows, push-ups. You could use your body weight from the beginning, right? You can use that to get you on the right path with squats, push-ups, and so forth. Use your body weight initially. Ditch the cardio obsession, right? Walking is great for general movement, but long cardio sessions can actually make it harder to build muscle. So you're not also eating more and lifting, right? If you're doing a lot of cardio, make sure you're eating extra. So check your labs. Ask your doctor or practitioner to run thyroid labs, ferritin, vitamin D. Low energy and inability to build strength can be related to underlying nutrient or hormonal issues. So building lean mass takes time, but within 2 to 3 months of consistent training and fueling, you'll feel stronger. You also have more endurance and look more toned without needing to lose a pound. So there's other things that go into it. All right, this is Tommy, 42 from Georgia. This listener question number 4. My wife and I are trying to get pregnant. I started to wonder if my own health plays more of a role than I thought. I always heard fertility talks focus on women, but is there anything men should do to improve sperm health? So absolutely, Tommy, your health matters as much as your wife's when it comes to conception, right? Male fertility issues contribute to 40% of infertility cases, and sperm health is heavily influenced by lifestyle, nutrition, and environmental exposures, right? Too much metals in your diet, not enough hydration, not enough zinc. There's a lot that goes into this. Key ways to improve sperm quality, nutrient support. This would be zinc, selenium, CoQ10, CoQ10, depends how you say it, L-carnitine. These have all been shown to support sperm motility, and high-quality men's fertility vitamins is a smart investment, right? And make sure you're getting a high-quality multivitamin, but there are ones out there for fertility. So limit heat exposure, avoid hot tubs, tight underwear, laptops on your lap. All can reduce sperm count by increasing a scrotal temperature. So again, you're going to have to ditch those hot tubs and saunas. Reduce toxins, minimize exposure to plastics, especially BPA, pesticides, or heavy metals. Use a water filter and eat organic when possible. Watch alcohol and smoke. I don't know if you do either of these, but both decrease testosterone and can directly damage sperm DNA. Another important one is sleep and stress. Both of these influence your testosterone rhythm. Poor sleep or high stress over time will lead to low hormone levels and poorer sperm function. So if you're really serious, get a sperm analysis. You could go to your primary. They can send you to the right person to get this done. But this will give you a clear baseline. So there are good news. Sperm regenerate every 70 to 90 days. So small changes now can yield big benefits in just a few months. And we hear on the opposite side of the spectrum, you hear don't go in hot tubs, don't go in saunas, and don't do like TRT and stuff like that because it's going to lower sperm count. But maybe that's what some of us want. Listener, and final question, listener question number 5, Jeanette, 61 from Ohio. It's been a few years since menopause, and honestly, I didn't expect to feel this out of sorts. I have joint pain, dry skin, sagging muscles, brain fog, and I've become more emotional. Everyone told me that once the hot flash stops, it gets better, but I feel like my body is just different now and not in a good way. Is there anything that can still help? I don't want to go to this and take synthetic hormones, but I also do not want to accept that this is just my new normal. What options do I have this far out from menopause? That's a good question, but what you're experiencing is unfortunately very common, right? It's rarely talked about. The postmenopausal phase still comes with real shifts, especially if no support was provided during transition, but there's hope. Not too late. Here's where you could focus on tissue support, collagen, type 1, type 3, vitamin C, silica, and omega 3 can help support skin, joints, and connective tissues. Hormone mimics, phytoestrogens, which is flax, fermented soy, red clover, which gently bind to estrogen receptors and may reduce symptoms without synthetic hormones. Another one, people are surprised on this, is strength training, right? Lifting weights 2 to 3 times a week boosts muscle tone, mood, and bone density. Especially as we get older, you want to lift light weights to maintain muscle mass. It's beneficial for your brain and your heart and your body in general. Cognitive supplements considered COPA. Another one would be magnesium threonate. These both help support memory and keep your body calm. So what I always tell people too, everybody says they're in postmenopausal, premenopausal, in menopause, do lab testing to really rule that out, to show that. You don't go based on symptoms, because you could have, we'll get into it more detail on a different episode when we cover menopause, but there's a lot of symptoms that mimic each other. We have, for men, they think it's low testosterone or low testosterone levels because they'll test and say, my testosterone is low and I have these symptoms, so it must be an issue with testosterone, when it's really their thyroid. Thyroid and testosterone mimic each other, and the same with menopause and thyroid issues for women. Do functional lab testing, right? We always say the well-known one out there is a Dutch test, but organic acid tests can both uncover neurotransmitter imbalances, cortisol regulators, and detox pathway sluggishness. So again, Dutch test or OAT can uncover neurotransmitter imbalances, cortisol issues, and detox pathways to see if they're sluggish, and they may be contributing to your symptoms. So you deserve to feel strong, be clear-headed, and support every stage of our lives, right? There's a lot that goes into this. That's it. That was our last question, but hormones play a big role in our lives, right? Due to proper functional testing, we'll get you on the right path. So that wraps up this episode of Mindful Objective. We answered 5 important listener-submitted questions. Again, these aren't minor annoyances, right? They're signals, your body way of asking for support. So when we approach these issues with curiosity and root cause thinking, we gain the power to create real lasting improvements on how we feel every day. Right. Remember, this podcast for informational educational purpose only. We do not diagnose, cure, or treat any illness or disease. So again, if this podcast was helpful to you, or you may know somebody experiencing one of these issues, feel free to pass it on. We want more people to identify our podcasts, hear us. Hopefully they walk away with something, free information, and they could always reach out, or if you can reach out if you have any questions. So again, your story and your willingness to learn can be encouragement that others need. Maybe you help pass it on. So if you want your question answered in a future episode, visit mindfulobjective.com/podcasts. Again, mindfulobjective.com/podcast. Don't forget to follow us at Mindful Objective for daily health tips, resources, and inspiration. Until next time, stay grounded, stay empowered, and keep listening to what your body's trying to really say to you. Stay well.